Hello and welcome to RWAV Grants for Doctors information session. I'd like to thank you for taking the time to attend the session today. I know you're all incredibly busy, so we do appreciate you taking the time out of your day to attend. Just as a matter of course, could I ask that all cameras and microphones are turned off or onto mute for the duration of the session. The session is being recorded for future reference and will be included on the RWAV website. I would like to point out, however, that no participant details will be included in the recording. Let me begin by acknowledging the traditional custodians of the land on which we meet today. RWAV is located on the Wurundjeri land of the Kulin Nation, and I would like to pay my respects to the elders of this land, past, present and emerging. I extend that respect to any Aboriginal and Torres Strait Islander people with us today. A little bit of background about RWAV for those of you who are not familiar with us. The Rural Workforce Agency Victoria is a not-for-profit government-funded organisation with a goal of improving healthcare for rural, regional and Aboriginal communities in Victoria. We provide a range of activities and support to improve the recruitment and retention of health professionals to rural and regional Victoria, and part of this support is including grants. Our grants are designed to help you achieve your career goals, including relocation, professional development and postgraduate education, which will then enable you to support your rural community. Grants are available for medical, nursing and allied health professionals and practice managers and staff working in regional and rural Victoria. The grants are also available to students who are looking to work in rural healthcare. Coming up in this presentation, we'll talk about the various grants that are available to doctors, and today's presentation is specifically around grants available to doctors. We'll also touch on the cultural safety training that is provided by RWAV. We'll show you how to create a My RWAV account and also how to apply for the RWAV grants. As I mentioned, the session will be recorded and stored on our website for future reference. And if you have any questions, please do drop them into the chat box and we'll answer them at the end of the presentation. I strongly encourage you to always check the RWAV website to make sure that you're looking at the most current version of the guidelines. The guidelines are updated on an annual basis, usually based on a financial year. So please make sure that you're looking at the most current version of the guidelines. And the other thing that I encourage you to do is to check back regularly on the website because the range of grants on offer changes throughout the year. Let's just begin with a brief testimonial from one of our previous grant recipients. So Dr. Shirazi has provided a brief testimonial.
Hi, I'm Shirazi. I'm a GP working in Malakuta, Victoria, in East Gippslandshire. I received a Health Workforce Scholarship Program grant to complete my RACGP, Certificate of Primary Care Dermatology. This course really helped me to diagnose and manage skin problems locally. Otherwise, the local community members, they need to travel 2 to 3 hours to get these problems sorted out. I'm really happy to receive the grant and to complete my primary care dermatology certificate. Thank you.
So thank you, Dr. Shirazi, for that testimonial. So let's have a little bit of a think about the benefits of applying for the RWAV grants. They can be used to complete training and upskilling that you've always thought about doing. They can help you to take on cutting edge training to keep your skills sharp, no matter what stage you're at in your career. The upskilling can help you to better serve your community through expanded service offerings. They can also help you to bolster your CV and get some of those all-important CPD points that everybody needs to chase. Throughout the application process, you'll receive support from RWAV, and we encourage you to take advantage of available funding, which will cover courses or training, accommodation, and also transport. So what sort of activities can the grants be used for? Well, there's a list here of the different things. So it can be any postgraduate courses that you may be doing, short courses, workshops, conferences and seminars that are relevant to your field of practice, vocational education and training courses, professional association CPD requirements, and this includes fellowship preparation courses. They can be used for recognised industry skills training and upskilling, resources for exam preparation, and as mentioned before, they can also assist with travel and accommodation. The courses and activities don't need to be accredited, but they will be assessed by the RWAV team for relevance, value for money, and the likelihood to meet the identified primary healthcare needs of the community in which the applicant is working. A lot of the RWAV grants are restricted to those who are working in private practice. So why is this important? Well, one of the key eligibility criteria for the grants is whether your employer is a private provider or a government-funded organisation. The guidelines around the grants state that to be eligible, the applicant must provide services full or part-time in the private or non-state government primary health sector. The Department of Health fund these grants, and they're the ones that set down the guidelines, which are then administered by RWAV on behalf of the department. Unfortunately, it's not within the scope of RWAV to be able to make these grants available to those who are employed solely in the public health sector, as this doesn't fit the department's criteria. However, having said that, we do continue to advocate on your behalf to the department to allow non-private providers to gain access to RWAV administered grants. The first grant that we'll discuss is the Health Workforce Scholarship Program. So this is a series of either scholarships or bursaries which allow you to pursue further education or attend short courses, conferences, meet your professional development requirements, etc. The HWSP is funded by the Commonwealth Government and is administered by RWAV. So eligible locations to apply for this grant, you need to be working in a M 3 to 7 location. If you're working for an Aboriginal medical service or an Aboriginal community controlled health organisation, you're eligible no matter what M location you're in. As mentioned before, they're only available to private or non-state government primary health sectors. However, this does include community health if it's not state funded. The maximum claim for an HWSP grant is up to $10,000 per person per financial year for permanent staff, and for locum staff, it's up to $4,900 per financial year. Eligible applicants include general practitioners and GP registrars, and you can be working either full-time or part-time. If you're permanent, we expect that you continue to be in an eligible location, so in one of those M 3 to 7 locations for the next 12 months. For locums, you need to have provided at least 152 hours in the eligible location in the previous 12 months, and you need to undertake to work at least 72 hours within the next 6 months. Eligible activities a planned increase in skill capacity and or scope of clinical practice. So it needs to also be meeting one or more of the identified primary health workforce needs and demonstrate primary health service provision to rural and remote communities. For the HWSP, you need to apply for the grant prior to commencing the activity. The second grant to discuss is the Medical Professional Development Program. This program supports ongoing professional development and medical education of medical practitioners in country Victoria. It also aims to encourage trainee doctors to complete rural and regional placements by providing access to professional development subsidies. This grant is funded by the Victorian Government and administered by RWAV. To be eligible for the grant, you need to be working in a M 2 to 7 location. Eligible applicants include general practitioners, GP registrars, and also importantly, medical interns. The eligible activities include continuing professional development, as the name of the grant says. The maximum claim is up to $3,000 per person per financial year. And for this grant, you apply after completing the activity, but within the current financial year that the activity was undertaken. So these are the two main grants that are relevant to doctors. And just to quickly summarise the difference between the two grants, Health Workforce Scholarship Program is available for M 3 to 7. You must apply before you start the course. It's capped at $10,000 per financial year and is used for upskilling and exam preparation courses. It's really important to note that it does not cover exam fees or membership fees. The Medical Professional Development Grant is eligible for MM2 to 7 locations, and this one is applied for after the course is completed and a certificate of attendance or a certificate of completion can be provided. It's capped at $3,000 per person per financial year and is only for upskilling courses. It does not cover exam preparation courses. So unfortunately, if you're a doctor working in an MM2 location, we cannot help you with covering costs for exam preparation courses. Applications for the MPD need to be submitted in the financial year in which the course was completed. The East Gippsland Trust Fund grant is a very specific grant and designed to support retention of GPs in certain areas of Victoria. So it was funded by a trust fund set up by the East Gippsland Primary Health Alliance and has been administered by RWAV. And due to where the grant was set up and the nature of the setup, eligible locations are only Wellington Shire and East Gippsland Shire. So if you're outside of those, you're not eligible for this grant, unfortunately. Eligible applicants could be either a general practitioner or a GP registrar, and doctors who are new to the Shire since the 1st of the 1st, 2020. The sorts of activities that we can fund are rent and personal internet costs. We can cover local vouchers for things like sporting clubs, restaurants, local theatre, anything that's putting money and keeping you involved in the local community. And we can now also provide some reimbursement for the costs associated with locums. The maximum claim is up to $6,000 per practice, but funds are made payable to the eligible doctor. The practice should apply after completing the activity. What we usually suggest with this is that the practice manager coordinates the claims for this so that they can be sure that if you have, say, 3 doctors in the practice who are eligible for funding, that one doctor doesn't claim the whole $6,000 and leave the others with nothing. So we just ask the practice manager to keep a little eye on what's going on here. So that's it for grants per se. I just wanted to talk to you a bit about the cultural safety training courses that we provide through RWAV. So RWAV's collaborated with the Victorian Aboriginal Community Controlled Health Organisation, otherwise known as FATCHO, to facilitate cultural safety workshops for primary healthcare providers and also support staff in rural Victoria. All sessions are delivered by an experienced Aboriginal and Torres Strait Islander facilitator, and they're limited to a maximum of 20 participants, just to allow adequate participation by everybody. The sessions are provided free of charge to eligible applicants. They're funded by RWAV and the Department of Health for eligible healthcare providers and healthcare students. The sessions are currently being run once a month, but will be run more frequently if required. At the moment, all sessions are run online. There are no face-to-face sessions. In order to register for one of these cultural safety training sessions, please just go to the RWAV website. Across the top, you should select Workforce Support and then Cultural Safety Workshops, which is the last item in the drop-down. RWAV places a great deal of importance on cultural safety, and we work closely with VACCHO and also the ACCOs. We believe it's very important for all healthcare providers to participate in cultural safety training, and to support this, we fund these cultural safety training sessions to make them readily accessible. So if you'd like to apply for one of the RWAV grants, the first thing you need to do is to create a My RWAV profile. And let's just have a little look at how we might do this. So begin by going to the RWAV website, select the My RWAV in the top right corner, select register, and then enter your details and click register at the bottom. If you happen to forget your login details, please contact us to see if we're able to help you out. You will, however, need to remember which email you used to create the account. If you're having trouble remembering your password, you're able to reset that yourself. But as I said, if you're having any issues at all, please feel free to contact us. And this is just a spelt out version for you of how you go through. So just to step through and how you create that account. Once you've created a My RWAV profile, you're ready to apply for a grant. So to apply for a grant, go to the RWAV website and find the Grants tab, and then select See All Grants. To find the grants that are specific to you, you can click on your profession in the drop-down list, select your profession, and then do search. Alternatively, you can browse the grants page. To apply for a particular grant, find the grant you want, click on Apply button, and then log in and complete the online application form. You can save a partial application if you run out of time or you find you need to go back and provide some additional information. It's really important that once you've completed the information, you click the Submit button at the very end. If for any reason your application is rejected, so perhaps you didn't provide a document that was required, you'll receive notification back. You log back in, add that document, and then press Submit again. So I can't stress enough to press that Submit button, because without that we don't get any notification of your grant application. And again, just down here in bullet point for you is how you can apply for the grant. So just a reminder once more, I strongly encourage you to read the guidelines before you start to apply. So we don't want you to waste your time applying for a grant that you're not eligible for, or you find that you're not able to meet the necessary commitments of the grant. And those commitments might be something like a 12-month return of service obligation, which means you need to remain working in rural Victoria for 12 months after the receipt of the grant. It might mean that you can't complete your course within a given time frame, which may well be specified in the grant. Or you could be applying from within the wrong M location, or before the grant, or after, or before or after you've actually done the course. So they're all things to make sure that you check before you actually start applying. So some tips for applying for the grants. As I was just saying, make sure that you meet the eligibility criteria before applying. If you're unsure about your eligibility criteria at any point, or you've got any other questions, please contact me via email at catherinem@rwave.com.au, or you can call us, and that's my direct number there, is 9349 7854. Once again, make sure you read the guidelines carefully, answer all of the mandatory questions, which are asterisk in that form, and keep your answers succinct and only include the relevant information. That concludes the presentation. Questions will be run as a separate little event, and you should be able to find them located on the RWAV webpage now. Thanks everybody for your time and good luck with your grant applications.